Anatomy Basics Part 2 is all about directional terminology. And directional terminology is always used in reference to something else. And so when I'm thinking about directional terminology, I need to think about where I am in relation to other parts of the body. So anterior chest is as I get more and more to the front of your chest, that's going to be the anterior chest. And I can be anterior in relation to other parts of the body. Posterior is going to be further back. So as I come further and further back, this is more posterior. So certain references you want to be familiar is, am I anterior to that structure or am I posterior to that structure? Different specialties will also use ventral or dorsal, which is going to be stomach side, ventral, or dorsal, which is the back side. We can also use distal versus proximal. And so distal is going to be more and more further away from your midline and the center of your body. So I come more and more distal down my arm, I'm getting further and further away from the center of my body. I come more and more proximal, I come closer and closer. So here, this is my humerus or my arm, I'm proximal humerus, and here I'm distal humerus. I can also think about things in relation to different planes like we were talking about earlier, which is medial or lateral. So my median plane or my sagittal plane cuts me straight in the midline. So I'm median is straight in that midline. This is my clavicle right here, which is that bone that sits right here in the front. I'm medial part of my clavicle, lateral part of my clavicle. So as I come closer to my midline, I'm going more medial. As I'm coming out, I'm going more lateral. I can also think about up and down, or upwards and downwards is going to be superior and then inferior. So as I come up, I'm going more and more superior, and as I come down, I go more and more inferior. So this part of my arm is going to be superior, so my superior humerus, this is my inferior part of my humerus as I'm coming down. And then in addition, I want to do cranial or caudal. So caudal, I remember the U is pointing down, so caudal is coming down, and then cranial or cephalad is pointing up to my head. I can also go external or superficial, or I can go internal and deep. So as I come further and further into my body, I'm going deep or internal, and as I come further and further out, I'm going more superficial or external. I can also do in relation to my hand, this is the palmar surface of my hand, so my palm, or the dorsal surface of my hand, which is the back of your hand. We can also do it for your feet. So here, the dorsal or the top side of your foot, or the bottom is also the palmar surface of your foot. So anatomy directional terminology is all about reference to other portions of your body, and it's really going to be helpful when you're trying to learn the basics of where you are in reference to other parts of the body.